Namaste. Today we will discuss one important topic, how much water one should drink. Either is a normal person or a kidney patient. Friends, I am Dr. Anil Kumar Patro. I am a senior consultant, kidney specialist and transplant physician at Apollo Hospital, Visakhapatnam. Why I chose this topic? Patients are confused, advised differently regarding the liquid intake, whether they should drink more water, should drink less water. Even general population also, they are also confused. They are advised by different people to drink excess water so that the kidney function will be better, or if the patient is already having some kidney disease, to improve the kidney function, they are advised to drink more water. Coming to water intake, our body requirement on an average in normal conditions, normal climate is around 2 to 2.5 liters of liquid intake, not only water, whatever liquids we drink every day, that will suffice. Or maybe if we are going in a hot summer outside, sweating a lot, exercising a lot, then probably another 500 ml of liquid intake should suffice. Whereas some people, they drink excess water. In the morning they will drink 1 liter of water while they wake up. Again after breakfast another 1 liter. Like that lunchtime another 1 liter. So they end up drinking around 6 to 8 liters of water, sometimes 10 liters of water in a day. What happens? Suppose we drink more water. If our kidney functions are normal, young adults, then the extra water is excreted as urine output and usually nothing will happen. Whereas elderly people who have some kidney ailment and decreased heart function, for them this will cause a tension of extra water in the body and will lead to swelling in the feet and also breathlessness. They start having more breathlessness when they lie down, they cough a lot, so that extra water is not getting cleared by the body. In these situations, how much they should drink? Normally a person should drink water about 500 ml plus his or her urine output. Suppose the urine output is around 1 liter or 1.5 liters, another 500 ml of liquid intake should suffice. But in conditions where body has more water, like cardiac failure, pumping of the heart is less, we call it ejection fraction, and there is a kidney dysfunction, diabetics, hypertension with CKD, whose excretion of urine is less, they will retain more water, they will end up in breathlessness, which is due to pulmonary edema and swelling of the feet and hypertension, high blood pressure. For them, there should be liquid restriction. So we should not think that if we have kidney dysfunction, drink more water, the kidney function is going to improve. It exactly doesn't happen like that, unless the kidney dysfunction is due to dehydration. If there is a decrease in the body water content, that is called dehydration, then probably the intake of more liquid will help to improve the kidney function. Whereas almost all other types of kidney dysfunction, like chronic kidney disease and chronic glomerulonephritis, these patients will present with swelling of the feet, breathlessness, high blood pressure. We need to restrict the liquid intake. Once one person takes more water, particularly elderly people, they end up in hyponatremia, that is called dilutional hyponatremia. Hyponatremia is due to decrease in the sodium levels, blood sodium levels. But in fact, the body content of the sodium is normal in these patients, whereas due to the extra water, that causes dilution of the sodium and cause dilutional hyponatremia. In these situations, the treatment should be directed at the cause, that is more water in the body. So you need to decrease the water intake and try to excrete more water from the body. So the treatment is diuretics, means to increase the urine output. Whereas sometimes they may be advised to take more salt to correct the hyponatremia. What it causes? It causes more of thirst, more water intake, more dilutional hyponatremia. That is a vicious cycle. So to correct the cause of hyponatremia in elderly, most common cause is to decrease the liquid intake. Then come to the patients with kidney dysfunction. There can be patients with chronic glomerulonephritis or chronic tubulointerstitial nephritis. Basically, the difference is in chronic glomerulonephritis, patients will have decrease in the urine output and the swelling, whereas some patients can present with normal urine output with severe kidney failure. In these situations where the patient has normal urine output, they can drink normal amount of water. Whereas coming to the patient where urine output is less or almost absent, for them there should be a restriction of liquid intake. Then taking more water intake is not going to help them. How these patients will present of hyponatremia patient? Usually they will present with decreased appetite, nausea, vomiting, altered sensorium, fall at home without any cause, and in the extreme cases can present with a seizures, that's fits. So these patients should be properly evaluated to find out the cause of hyponatremia, and if treated they will improve. Usually they will present to the neurology department, but on evaluation will found to have decreased sodium. Decreased sodium patients almost always will have some degree of renal dysfunction, kidney dysfunction. With normal kidney function, usually the hyponatremia is rare because the extra water will be excreted by the kidneys. So if there is a hyponatremia, we should always try to rule out kidney dysfunction. My advice will be to drink around 500 ml plus whatever the previous 24 hours urine output, that is the liquid intake. Not only water, liquid intake means drinking whatever liquids we drink, like water, tea, coffee, milk, whatever liquids we drink, that should be around 2.5 or max of 3 liters in 24 hours. And people who have normal kidney function like young adults, they can drink excess water, around 4 to 5 liters if they are going out and working in a hot environment. For them probably 4 to 5 liters should be okay. Another one situation where patients have a recurrent kidney stone disease. These patients, they should drink more water, because once the urine is concentrated, the chance of recurrence of kidney stone is high. So we need to increase the liquid intake and decrease salt intake, and also non-veg, like particularly red meat. Red meat causes more of calcium excretion in the urine, and they are also likely to produce calcium stones in the kidney. So patient with history of renal calculus, that is kidney stones, should drink little more water to dilute the urine output. To wind up, probably we need to restrict liquids, because water intoxication in elderly is more common than dehydration. So water drinking in excess water will not be always good. We have a control system in the brain where if we are dehydrated, we will feel thirsty and we should drink water. If you are not thirsty, don't drink excess water. That is my advice. Thank you.